Students with low incidence disabilities are found in a lot of classrooms, not all the time, but they are becoming more prevalent. It is not an impossible mission. The learner outcomes for Chapter 6, Module 3 require us to be able to explain what a student with a low incidence disability means. We're also going to be able to outline characteristics and describe accommodations for students with low incidence disabilities. And finally, we're going to be able to more critically analyze beliefs and skills when it comes to implementing inclusive practices for students with low incidence disabilities. So the important vocabulary are listed here, and I want to point out developmental delay in particular because that is a category that is usually designed to be fairly broad for students who are birthed to approximately age 7 prior to any real diagnosis of a disability. They are given a variety of different services and evaluations because it might not just be very clear. The rest of the vocab you see there are going to be talked about in both PowerPoint 1 and 2 and as you read the text. Some fast facts about low incidence disabilities. If you were to have 100 students with disabilities, 20 or 20% would be identified as having a low incidence disability. So really, we're not talking about a lot of students here. The 8 federal categories are listed, and as you go through this chapter, you're going to be listening to videos and podcasts that give you an overview of the 8 categories. The first one is orthopedic impairment, and that's any physical or orthopedic disability, whether upper or lower body, that impacts the movement and educational opportunity for students. The second one, other health impaired, talks about a wide variety of students with diseases and health-related issues, from asthma to childhood cancers. Traumatic brain injury is any type of sports-related closed or open head injury from a blow to the head, whether it's a car accident, gunshot wound, shake-it baby syndrome. All of those would fall in traumatic brain injury. Hearing and visual impairments, those are considered mild, moderate, or severe, but regardless, they affect a child's learning ability. Deaf-blind is a category all by itself, even though it has the fewest number of students, but it's one of the most complex because of the nature of the disability. Multiple disabilities is also complex, and it requires that each of the types of disabilities that are included in that are addressed separately. Generally, we're talking physical and some cognitive and possibly some medical disabilities that are all combined. Autism is a rapidly growing area, and according to Centers for Disease Control, nearly 1% have some form of autism. That's 20 times higher than it was in 1980. Some are considering this an epidemic. Others are considering it better diagnosis. You be the judge. Intellectual disabilities, we're talking here the significant cognitive disabilities used to be called mental retardation, but we're talking approximately 50 IQ or lower and some difficulty with adaptive skills. As you consider the different students that you serve who have low incidence disabilities, remember that your values, your beliefs, your attitudes, and your behavior impact the kind of work that you do. If you expect little from students with low incidence disabilities, you will get little. Less is always less. So use what you've learned from Chapter 6, your reading, and you're viewing the videos to obtain ideas for best practice and accommodations that you can use in your individual setting. True or false now? Students with low incidence disabilities have tremendously diverse abilities, challenges, and needs. Absolutely correct. Way to go. Next, general education teachers are not expected to adjust expectations or teaching for students with low incidence disabilities. That is false. If you said false, you're on a roll. The last one, classroom supports and accommodations are necessary for students with low incidence disabilities. Again, that is true. We will have a good deal of ideas when you are finished with this chapter.